so many kids out there with anxiety, depression, and they're struggling. So could you help me kind of set the stage a little bit? Like what are you seeing in your practice or, your prior practice? And then we're going to go from there.
Yeah, and thank you so much for giving me the opportunity to speak about this. Talking about mental health and mental wellness is so near and dear to my heart. And so any chance that I can to talk about it, I get so excited about. But it's been rough. It's been from the start of the pandemic. I think everyone's been struggling. We've all been struggling, but I think kids and adolescents have been struggling a lot more. And, we've seen it being reflected in the numbers of kids that we were seeing. So, before I worked on an adolescent inpatient unit, and our numbers were through the roof. We had kids waiting for beds for weeks. We had kids who being discharged from emergency rooms who needed higher levels of care but just couldn't get into the inpatient units or the outpatient programs. There's just such a huge need and not enough resources to go all the way around. But I do think one of the things that has come out of this is just there's been so much more focus on mental health. And I think that the conversations have been going and people have been really interested. And so I think that's how we can really gain some momentum and get kids the care that they need. Yeah. So, I think when I think about the warning signs for mood disorders, I think about in different age groups, right? So you have the signs that you would see in younger kids may be very different from what you would see in adolescents. But in general, you're looking for any changes. So whether that be changes in appetite, you're looking at changes in sleep. For kids, younger kids, we tend to see more physical symptoms. So we tend to see more like headaches and stomach aches that can't really be explained medically. You can get that in adolescents as well, but we tend to see that more of that in the younger kids. We see, changes in mood, more crying spells. Little kids, we tend to see more irritability, being more on edge. Adolescents may present as being more sad, more depressed. But a lot of times we'll see some isolation. We'll see, withdrawing from social activities that they really enjoyed before. But it's when you have at least a couple weeks when you notice, okay, something's feeling off. And I think that's when it's important to really check in with your pediatrician or whoever is providing care, because then we may not have the words to describe it, but I think that's where the conversation can start. And I think you know your child best as a parent. I meet a lot of parents who get very anxious about asking questions, especially around safety, especially around substance use. And my advice is just ask. You have to be direct. This is not something that we want to play around with. This is something we need to know. And asking your kids directly, are you having thoughts about hurting yourself? Are you using any substances? Is the way. I think beating around the bush, trying to get the answer is never really helpful. We want to normalize asking our kids very direct questions so we can help them in the best way possible.
Yeah.